get that done. We sent out minutes to everyone, which we call ourselves to order. Do we have any pressing interests that anyone would like to announce at this time? Okay. So we've sent out minutes of the last meeting. Has everybody had a chance to read them? They were done quickly, or just shortly ago. So if anybody's had a chance to read them, I would appreciate a motion to accept.
I'll motion to accept.
Great. Excellent. It's been moved and second. All in favor, please signify by saying aye.
Aye.
Any opposed? Okay, those pass. So let's talk a little bit. I'm on the agenda to talk a little bit about the integration of behavioral health with the district. For those of you that don't know, as of August 1st, Lake Health District is now running Lake County Mental Health. And we're working on integrating that right now into working with more effectively with the doctors, working more effectively with our community, and hiring more people. It's one of the things that has not been happening of late. So we're into day 11, so it's not like we've solved all sorts of problems yet, but we have hired at least one therapist, and we have been interviewing for the directorship position. We have several candidates, so that's exciting. We hope to have that buttoned up pretty quick. A study was recently done on the needs of behavioral health, and we're changing the name from, it won't be Lake County Mental Health. Right now it is Lake District Behavioral Health. And we have a contest running to rename it. We're still finishing up with our all the names that have been submitted. And so we'll soon have that list ready to present and choose the best name. But by changing our direction, we think that we'll be able to accommodate the board and our community's needs, and certainly work with our practitioners and integrate better, both physical and mental health. So we're excited about the prospects. Right now, there won't be a lot of changes in terms of location, but I would anticipate that in the near future, we'll be looking at what some of the options are. We've talked many times about bringing behavioral health here on campus. We do provide some behavioral health services here, but we have responsibilities for not only Lake County, so since it's all Lake County, that includes Northland, we provide service here. So, any questions about how we see this might be changing?
You know, I'd have a couple, Charlie.
Please do.
Well, first, I was looking at the model or the architectural drawings of the clinic expansion. Is there, I mean, I know that stuff takes a while to get there. Is there thoughts in there about full integration of the behavioral health services into the future plan?
We are working toward that. And so what we're doing is, this is the rendition that we received yesterday from an architect trying to look at what are some of our options on our campus. And we're trying to figure out not only what it would look like, and how would we pay for it.
Okay.
So
I asked the question only because there's been a desire at a lot of our primary care clinics to have more direct integration, but physical space has been a problem for folks. So I'm just encouraging to think about that in terms of future expansion.
And we are very, very much keeping that in mind. And so as we look at how do we best use the facilities that are here, or if we were to build new facilities, how would we go about doing that in the most cost-effective fashion? You know, when you integrate on a hospital campus, sometimes the cost is more expensive than if it were not on a hospital building or attached to a hospital. So we look at all those factors.
And
Other
then-
questions?
Yeah, well, the second one is just an offer. Last month, we finally got all of the physical health data, all of the oral health claims data, and all of the mental health data together.
Really?
Yes, and so when Juanita, who presented at our last meeting about the patient-centered primary care home status, works, our focus is on those clinics that have achieved tier 3, which you guys will easily get, but at that point, we will bring that data to your clinical leadership team along with the mental health folks and can look at all of the data together. When we just did one, it was pretty amazing that there were many mental health diagnoses on the physical health records with very little actual contact with the mental health system. And then it's also tied to spending, so we'll know exactly who the hotspotters are. And there's risk scores in there from the insurance side that predict the people who are going to be expensive next time, which is where behavioral interventions can be done outreach-wise, which is an excellent thing for you because you have a risk contract for primary care, right? So all the better.
And I believe there's a risk agreement on the behavioral health side also.
Yes, they're capitated, right?
So I'm working on understanding all of those.
But once that's there, we can just plug the data in and come down and read that.
Excellent. I think one of the things that we want to be able to do is, as we look at data, change that into information, and then with that, act based on that, and improve how we deliver service and the health of our community. So I see that as being a really positive thing for all of us.
Well, there's actually two presentations. One can be done among a group like this that are not necessarily HIPAA compliant, but the other has all of that information in a statistical software package so that clinicians can ask questions about how often each of the things can live, but it would be associated with patient names, so that's.
We'd have to have a different group.
Yeah, but we have already done two presentations, one for a general audience like this so that they can see the scope of what's really happening.
So that's something we might look for in September, October.
Yes. Do you know when Juanita plans to attest?
She already did.
Oh, she did? Then you are, correct?
Yes.
Congratulations.
Well, I assume we are. I think do we hear right away?
As soon as you push the button, you get a response back that says you're tier 3 and can print off the little certificate, so.
Okay. I know we attested.
Then the Oregon Health Authority sends a note to the EOCCO, and so let me know if you don't start getting the additional per member per month payments right away, because there's been a delay on a couple of them.
Okay. I will let you know that.
Great, congrats to everyone involved there.
It's been a fair amount of work, and I think that that's a positive thing for everyone. So. Did you sign in? Is that what you're saying?
No, I'm asking her to sign in.
Oh, I already got it. I already got it.
Yeah, she got it.
So does anyone have any other questions about our integration with behavioral health? If not, we will be reporting lots of changes, but it'll take time. It won't happen immediately. But there's lots of integration of things that are going to make that happen.
What's currently, so is there kind of a transition plan, or so that who's kind of managing things now, and is there a transition plan then?
there's a combination of things. Right now, in order to head up a community mental health facility, CMHP, and that is a designation by the state, it has to be headed up by someone who is qualified. And the person that was qualified here in Lake County left. That was Ben Potts. And so the county is contracted with a company called Community Counseling Solutions, whose executive director is functioning in that role. So what the district did is contract with CCS, provide that service for 90 days until we hire a qualified person to accomplish that. The county would have had to hire somebody if they hadn't contracted with the district or the other applicant to them. So we have interviewed several people, and we're very close to making a decision. And then once that person arrives, then we'll transition that. So that is in the short term. Once that person is in charge of behavioral health services, and we start adding more people, then we'll start more of the adopting the program in a way that we're clear of what we're doing. We're granted a CMHP approval for 6 months, and then the state will come in during that time and inspect and do all the things they normally do. Once that is all gone through that process, then we'll have a permanent CMHP approval. And then the rest of it will move forward. So we're in a transition phase, and again, it's been 11 days. So there hasn't been all sorts of things finished, but there's lots. And there's lots of legal ramifications that go into that process. We'll have more to tell about that as it goes.
Will the mental health advisory board stay the same?
Yes, it will.
Okay.
They, by statute, the mental health advisory board reports to the CMHP and also to the commissioners.
Right.
So they'll continue to be involved in an advisory board. And we will, the CMHP will add more people to that, so we get a greater cross-reference representation, more people to give us advice. It's kind of comical. At one time, people were saying, well, we ought to have more people from the hospital involved. And I said, well, no, we want to have people from the community. We don't want to be telling ourselves what we ought to be doing. We ought to be asking others for input.
Yeah, they're required four meetings, I believe, and the Harney Community Advisory Council, this group, they serve as the
Mental Health
Advisory Board for Harney, and they also serve as the Community Advisory Board for the Developmental Disabilities Program. So during their meetings, they just say, okay, we are now, and do the information that they want and move to the next. And it just happens every quarter so that they can be compliant, because apparently some of the community mental health advisory boards aren't very compliant in terms of their meetings. So I don't know what the past has been.
I think that it has had lots of good participation. It has waxed and waned with its attendance because of people coming in different roles.
Right.
But I don't know, frankly haven't read all their minutes to know what they've talked about, some of the issues that they've dealt with. But I expect that we'll have much more information to know about it. Because the advisory board is very valuable, especially when you act on their advice. So, Paul, would you like to talk a little bit about the CCO incentive measures?
I just sent you an email with a report. I just got it on my way down here.
I'm not terribly excited about that report.
Well, the numbers can only get better, right? That's for the first
That's a
quarter.
very positive way of looking at it.
Well, then, as you go through, there's more of those services. Let me get to it real quick. I will point out that the efforts around the developmental program have really improved. You've already met your CHIP goal. You're at 38% of the eligible children have had their developmental screening.
Oh, that's, what's her name? Yeah.
Have you been doing that?
Exactly.
Right, well, Nora texted me, you know, who had been at the city and has come down and works on that grant. Wanted me to point that out. I did think that was pretty good. The SBIRT, which is substance abuse, brief intervention and training, it's basically a screening tool, can happen at the community mental health program or within hospital or within primary care. When I say the hospital, a lot of times SBIRT is sometimes conducted in the emergency room when people show up under the influence. And, it's been shown to have a better effect at getting people to treatment. We are very low in Lake there. It's 0.4%. So that's one. The other, again, the sealants on teeth will only improve as we do the services. Effective contraceptive use is pretty low at 10.5%. The emergency room use is low, which is good. We want that. Again, this is through the first quarter of 2016. But our adolescent well care visits, which we focused on with incentive measure dollars, are fairly low as well. But again, it can only grow at 4.8% of eligible people. So. I think Juanita's presentation last time around with patient-centered primary care home, the data that she was sharing and the way that they've set up their electronic health record can only improve these measures by allowing the clinic to easily identify those patients that need the outreach effort. And our colon cancer screening is at 11.6%. Again, that can only get better as we do more procedures.
What's the benchmark there?
60?
39.
39?
Right. And for those of you who were following whether we met the 2015 measures, 10. That's how many more people we needed colorectal cancer screening for in 12 counties in Eastern Oregon to meet that measure. 10. So with the populations that we have, you know, smaller, we can make great strides pretty quickly. That which is demonstrated by public health's coordination with primary care to focus on the developmental screens for kids. I mean, it went up like that from 14 to 38%. You know, so if we focus on something, I think we can move the numbers pretty quickly.
So are we gonna do the kids again for colorectal screening, or how are we gonna do that?
Well,
Is it just gonna be clinics, or?
Unfortunately, you're not going to know how much resources are coming to this LCAC until after September 27th.
That's our next meeting.
Which is the next EOCCO board meeting. But the current recommendation from the subcommittee, which has to be approved, will be about 5% of that 10.2 million to go to the CACs to be distributed at a core level, then based on the numbers of OHP members that are part of your community. So it will be more than what you had before, but you know, to start the conversation about what you're going to do, yeah, I mean, you can bet, you can look at it and say, okay, we have, well, I think you guys had 28,000 last year or something like that. You know, you can start thinking about it at that, but it's probably going to be, you know, somewhere in the mid-30s at least. But, you know, the thing is, it's August of 2016. We finally got our first report, and by the way, in that email chart, I don't know if you had a chance to see the note from the lady from MOTA that sent it. You know, the benchmarks are estimated. We still haven't gotten our official numbers from the OHA. But they're likely to be very close to this.
It's astounding to me that expectations in the 8th month are still not known for that year.
Well, we knew which measures we had, right? And that makes us some difference, I would think. If we know what we gotta work on, we know which ones we didn't meet, the adolescent well visits, colorectal cancer screening. You know, we did meet developmental screens. We gotta do something about the emergency department use, because that keeps going up. But we'll do that. But again, just as a reminder, last year, there was 10.2 million at risk. This year, it's 15.6 is at risk to meet these incentive measures.
And it's gonna be tougher.
Bar is rising.
Yeah.
Okay, so we'll not really know until September, the end of September.
What your resources will be.
Okay.
And hopefully though, because of the time lag, Charlie, and others, they wait, that you get the first quarter of this year, that's January, February, March, and then they wait 3 months because there's a claims lag. People can submit claims at any time. So by next meeting, I'm hoping we've got June through June, because then it would be, you know, July, August, and September on the lag. We should have a better picture.
Are there questions for Paul on our CCO measures, incentive measures, or the information? While we're talking about this, before we jump into John Adams' report, I failed to report that we have hired a new chip order. And his name is Arvinder Singh. He's coming from out of the area, from Ohio. And he is, has his master's degree in public health as well as a master's degree in business administration, and will be starting on the 29th of August. So we're very excited. We had some very, very good candidates, and it was which is always very exciting for us to know that we have good options. So we're very pleased about it.
What is his name again?
Arvinder.
Arvinder?
Arvinder, and his last name is spelled Singh.
Singh. Thank you.
He's originally from India, but now has been going to school in Ohio.
Where'd you advertise?
A lot of places.
I'm serious. I mean, I'm just curious how somebody sees a job.
We do lots of, I don't know exactly off the top of my head where all the different places are. I think we use Glassdoor as one, we use Craigslist, we use, I don't recall all the others, but there are some other sites from, that a lot of people in the public health world look at, especially in population health. There's a lot of interest, certainly on the graduate level, people outside of the state that are very interested in where things are going with population health. And that's what this is all about. So,
I have something real quick, just to give everybody a little update. I was working on, with Jamie Davis, because the Youth Health Ambassadors Program is getting ready to kick off. So they're actually gonna be training here with those adolescents tomorrow. Rosalind Apollo, who I guess trained the women's health advocates, she will be here. She's actually on her way up from Reno now.
Yeah.
We had some issues with her rental car. But she'll be here tonight, and then she'll be training with the extension office and those youth tomorrow. And then she's also gonna have a quick meeting with Women's Health Ambassadors, especially with having Mira leaving so quickly. She wanted to meet with them and make sure that they were on track with their program as well. So that's starting to kick off too.
One of the great things that'll happen is by having our vendor here, Jen won't have to do quite all of the stuff that she's been having to do, because
It's a lot, but that's okay.
Yeah.
sometimes
Okay.
if I say I'm gonna do it, then Jen does it.
Yeah.
Thank you, Jen, we appreciate it.
Mhm.
John, would you like to talk about EOLA?
Yes, I would.
Are you reluctant?
I have two parts to my presentation. One's kind of a larger kind of outreach presentation that we're doing with all the community advisory councils, just for kind of relationship building and so that we can be working closely with all the community advisory councils in the EOCCO area, and then just kind of a general update which we try to give monthly. And so I want to maybe I wanted to check in with you guys and just see what you guys thought about. So I think the first part of this presentation is a longer one. It's about 15 minutes, and it's something that I could do at any time. So I could come back next month, for example, and give this presentation. I'm just thinking about, first of all, I appreciate everyone, being here and your efforts to being here. But that being said, I think ideally we'd want to give this to kind of a full group. So I'll leave it up to you guys. I could certainly do that, or it's something that I could easily provide next month, but I would like to do it. Okay.
Because that'll be, I think some of our lighter attendance this meeting is a function of vacations and people being out. So we'll be able to.
We've got coordinators here about it too, so.
That'll be great.
So then I'll just give the updates.
We'll need
So
to,
do you need this then?
I won't need that.
Okay.
Mr. Chair, we'll need to make sure that we coordinate well for the next meeting. I gave you the heads up that we have Dan Schwantz and the non-emergency transportation program coming in September. On the 8th, I believe, is when the second Thursday is next month. But he's got, this group had a small discussion about it. I brought some data before about the percentage of rides per 100 members, and people ask, where are they going?
Right.
This data has that, and he explains the program. And usually we have transportation people here to be able to ask questions, and a couple of the presentations that I've seen that Dan's done, it generates a good response about how people can use the ride. So I think we'd be able to fit that in, but we just have to watch how many other things are scheduled for that meeting then.
Okay. We just recently had a meeting of transportation issues with the county and ODOT, talking about some of these. And the CCO transportation program was discussed. So, and that was, I think, 2 weeks ago. Here in the county. So we'll plan on that.
Right. Well, one of the things that we won't be able to see though, Charlie, when I looked at the data and they can't get it out of their system, is a north-south split. So you're gonna see a lot of Deschutes County, but that's where the rides were, but we won't know whether they were people from Lakeview or not. But it will show how many go to Cave Falls, which we can assume is not, North Lake.
Mhm.
Okay. North Lake, there are a lot of people that do go to Cape Falls,
Okay.
right? Yeah, that's quite a number. So it's not quite as far as, it's actually, the travel time is not as bad as you would have thought
Okay.
from North Lake. I was surprised to learn. John?
Sorry, John.
Yep, no problem. Yep, so we've been just giving monthly updates on what we've been up to with the Eastern Oregon Healthy Living Alliance. So this is just a continuation of that. We have a few grant programs, and one of those programs is the Healthy Happy Smiles program. Again, similar to the school-based oral health program that you all are providing. Similar to you all, we received a grant with the Oregon Children's Dental Health Initiative and the EOCCO. So with the funding, we're able to work in up to 23 schools in Eastern Oregon, and we currently have 2 in Baker County, 5 in Malheur County, 12 in Harney County signed up to participate with us. So that's 19 schools, and then we're targeting a couple more in Malheur County and a couple in Grant County. And we've just, we've been able to establish a relationship with a lot of the schools, and now we've been reaching out and working with the community advisory councils in those counties, and just giving outreach presentations and kind of working with them around one important piece is around the dental education that we want to provide to the kids in the schools. We're going to be purchasing a learning lab, a dental learning lab, and it's it's a tool that you can bring into the classroom, and it has all these different stations, and it's really an interactive tool for the kids to learn about oral health. And the unit itself is about $10,000, and so we've been working with the community advisory councils in the counties that we're in to just to help us get leads on organizations to reach out to raise some to fundraise around that unit, and then it also requires volunteers to help run the learning lab. And so looking at the community advisory councils again to help support trying to get us connected with volunteers.
Hey, John, that learning lab, does it require like materials to keep it, fully functioning? Do the kids take paper away or tools or anything? So once it's secured, then there's no additional expenses?
Correct.
Okay, that's.
Another program that we're providing is the mental health first aid. I'm not sure, kind of similar to last month when we reported, we've got some schools in Umatilla, Morrow, Grant, Wheeler. We've got the Lake County School District number 7 that's interested in getting the mental health first aid trainings here to the teachers, and we're waiting for some more of the staff to get back and to be able to schedule that training here in Lake County. And then we've got law enforcement in a couple of counties that are interested in participating, including in Union and Harney counties. And then the colon cancer screenings, again, we conducted the focus groups in 5 counties. All the 5 counties that used their incentive metric funding initially to try to impact the colon cancer screening rates, Lake County being one of those counties. And we're currently in the process of finishing that report and coming up with the findings that we can share with everybody. And we're also eligible for a renewal grant. So the grant that helped us to do the focus groups is with the OHSU Night Cancer Institute, and so we're eligible for a renewal grant. I believe we're eligible for about $50,000, and so what we'd like to be able to do is to partner with community advisory councils that are interested in continuing to try to impact that the colon cancer screening rates in the counties. And so I know this is something that you guys have been invested in the past and done some work around, and there's been some discussion here today. And if you guys are interested, we'd like to be able to partner with you guys. And at this stage, we're still developing the proposal, but we know that, what we want to do is to be able to implement some of the findings from the focus group that we conducted last year. And so I would like to see if that would be something that you all would be interested in working with us on, and then, we can work on maybe getting letters of support and kind of coordinating with you guys on the proposal.
That sounds pretty reasonable in terms of continuing the activities. And remember what John said, the first level, that was $3,100 from the 2013 incentive measure. So, I mean, it was just a small amount that was invested, and there's more of the local community advisory councils now that are targeting colorectal cancer screening. So I think that the findings from the focus group are probably going to exceed the funds for $50,000 though, so there may be opportunities. I forget when the night grant is due.
September 6th.
Okay, so before these guys would have any budget and be able to link in with that. So, but we hope that we would be able to get these folks the report, right?
Oh, yeah. Yeah.
So
Yeah.
you'd have some of the information before you had to make the decision on the funding.
When do you anticipate that?
September 6th is when the proposal is due. I'm hoping to have the findings finished by the end of next week. I don't know that I'll have it in a format that we're going to be ready to. I can share the findings, but I think the final product will take a little bit longer than the end of next week.
But the major themes could be shared, very similar to
Yeah.
what Abby's going to do here. She's got her report that isn't quite done, but
Yeah.
we got
It'll
her
be
done.
easier this time around because the ice has kind of been broken. People, that last year was the first year we went public with the colon, with screening and all that stuff. So I think this year it might be a little easier for the public to accommodate since they've heard it before.
How do you mean first time you went public?
The first time we did the colon cancer screening, we had the little packets and everything.
Oh,
And, yeah,
right.
and we didn't get that much of a turnout. We only missed, two.
Only two came out
I
of
know.
700 mails, which is why we said we need to do focus groups.
Yeah,
Oh,
so I'm
Yeah.
hoping with all the, talk about it, it won't be quite so daunting for people.
Right.
Well, as soon as you can get us that information, that would be good, and then we can talk about it at our next meeting. So we can plan on that. So do you talk about both?
I think that what might be helpful for the proposal is a letter of support, and I don't think it doesn't lock you guys in at all, but I think that it's a statement that you're supportive of what we're doing, and that we may be partnering with you guys on that. Is that something you think that we could do?
When is the proposal due?
September 6th.
It's up before it.
So are we retro, are we going back to the CACs that already met earlier this month to request that, John, or?
Yeah.
Okay. I mean, it's just a letter of support, it's not a commitment of any kind.
Exactly.
Yeah, all right.
Yeah.
I think we can probably accommodate that. Maybe you can help us with that.
Oh, yeah, absolutely.
Please.
Yeah.
Thank
You could just write it. and
Yeah. As someone who's written grants, it's hard to change the wording for 12 different letters, so it sounds like it was all written by different people, but I'll help you out there if you need to.
John, do you have anything else that you like? Or
No,
does
that's it.
anyone have questions for John? Thank you very much. Now we're ready for our star of the show today.
Hopefully the power doesn't
For all of you that don't remember Emmy Harcourt is our rare participant, who's going to be, has been working on our food insecurity issues.
Yeah, so this is gonna be from the community food assessment that I've been working on since October, which is now in rough draft form, that's it. So this is kind of an overview. I focus more on the food access issues since that kind of aligns more with what Chip is doing. Okay, so there's
Absolutely, that's what I was gonna say, why
Yeah,
don't
I'm
I
moving.
move?
Here, I'll move, so you
I'm
can.
good, either way.
Okay. So here you have the title, which is a portion of a quote from a local rancher who said, "You have to be tough like alfalfa to grow at an elevation like this." And that's kind of a theme that emerged throughout this assessment, is that you have a lot of people working very hard to create access to food in Lake County. So this is some background from this assessment. This was conducted between October 2015 and it'll be finishing up at the end of this month. And it was a partnership between Lake Health District, the Oregon Food Bank, and RARE AmeriCorps, which is a program called Resource Assistance for Rural Environments, which I'm a part of. The main research methods were individual interviews. There were about, I've done some more since I counted, but I think about 45 individual interviews that were conducted. And then 3 different surveys, which was a consumer survey, a survey for food pantry clients, and a survey of rural grocery store owners in the county. So that excluded Safeway, but it focused on kind of smaller stores located throughout the county. And then a lot of it was actually just informed by informal conversations with people as I was here for this year. And so this assessment is kind of meant to be a living document that's kind of a first step in kind of seeing what the strengths and the weaknesses that exist in the food system are and kind of building, organizing around that. So here's some statistics about food insecurity in Lake County. So food insecurity doesn't necessarily mean hunger, it just means that you're kind of unsure at some points about your next meal. So you can see that food insecurity in Lake County is 17.3, which is higher than the Oregon average. There's also a higher average cost of a meal in Lake County compared to Oregon. And then you have a quote from a resident in Christmas Valley. I'm paying the rent, I'm paying the electric, but I don't have anything for food. So there's a lot of people who kind of, food is the first thing you cut if you don't have enough money. And then under here, we have some things contributing to that. You have lower average incomes, higher unemployment than the rest of the state, 19.3% poverty. Transportation, there's long distances between communities and grocery stores. A lot of people drive, 90 plus miles to purchase cheaper groceries in Bend or Klamath Falls. And then you also have a higher senior population than the rest of the state. And so the USDA designates the entirety of Lake County as a rural food desert, which you have the definition for that there. So
Who does that?
USDA.
Okay.
And so in an urban area, the measure is 1 mile from a supermarket. In a rural area, it's 10 miles for 33% of the population or more.
And where did the numbers come from on the percent food insecurity?
That's from Map the Meal Gap from 2014.
So conducted locally or?
No, that's a national
Oh,
program, but these are the statistics, because they break it down by state and then by county,
okay.
but it's a national survey. So here's some information on participation in federal food assistance programs in Lake County. For SNAP, you have a lower percentage of people who are eligible participating than elsewhere. So and that number is even lower among seniors, so you have 41% of seniors who are eligible for SNAP are using it. And what I learned from kind of talking to people at the senior center is a lot of that is their clients feel like they don't deserve food assistance, or it's something that's kind of for young people with families, it's not for something for them. And so I think more education around SNAP usage would be a good outcome for that. Another thing is some stores in the county don't accept SNAP or WIC. People kind of know their cashiers, people know who's in line with them, so there's kind of, it's more visible if you are using these food assistance programs than in larger places. It's also kind of a lot, what I was told again is that there's a lot of pride and there's kind of some feelings about using assistance that lead people not to. And then also, even people who are using SNAP have unmet food needs. A lot of participants at pantries across the county are using SNAP and then come to the pantry at the end of the month when they run out of benefits.
Emmy, I've heard other counties have similar issues, that there's a bunch eligible and very few
Yeah, I
that are taking advantage of. You found that in other parts of
Yeah,
our
I mean,
region, or?
That's true everywhere that people are.
Okay.
There's no like 100% participation, but especially among seniors, it was lower in Lake County. And it was also lower than the average for rural counties for WIC usage. So you have 43% of pregnant women use WIC in Lake County, and then overall in rural Oregon counties, 54% of women use it. And then you have emergency food assistance, which takes the form of food pantries and emergency food boxes. But what I found is that the majority of people who use emergency food assistance are using it as a regular food source, and that is something that is common in pantries everywhere. But we did a food pantry client survey. 61% visited the pantry every month, meaning that it's a regular part of their food source. And when it is that's kind of when you need to be paying more attention to kind of the nutrition of the food that's being offered. So there's 2 new programs that have gotten more fresh produce into Lake County food pantries, and that's Fresh Alliance, which is taking food that can no longer be sold from Safeway, and Produce Connection, which is a seasonal program that gets fresh #1 produce into food pantry programs. But unfortunately, a lot of that is not reaching Christmas Valley. All the pantries in Lake County have to drive to Klamath Falls to pick up their produce, even though Christmas Valley is closer to Bend, they're not in that service region. And so there's a lot of new fresh produce in Lakeview and Paisley, but it's not getting to Christmas Valley. Okay, and then these are some eligibility rates for free and reduced lunch. Across Lake County, you can see in North Lake it's really high, at 73.6% are eligible for free and reduced lunch. And then Lakeview and Lakeview and North Lake are the only ones that actually participate in the National School Lunch Program. Paisley Charter School operates their own independent program, and then Adele and Plush, because they're so small, most students bring their lunch and then they just kind of have food available for them there. But because a lot of schools in the county are on a 40-week or a 4.5-day week, that leaves students without school meals for 3 days out of the week. So one way that was combated is in North Lake, a program was started by volunteers at Fort Rock Community Church, and they're providing backpack programs for students who opt into the program. And so they have 45 students out of 227 participating, and they think there are a lot more people who could be using the program, but their parents have just chosen not to opt into it.
I was reading in my local paper in Redmond and up in Madras, they're doing food every day, the school districts are, in like the parks. Do they do that here during the
I'm
summer?
going to talk about it in a second.
Oh, sorry.
But they don't, and that's the problem. So this is a little bit of information on the Paisley School Lunch Program. This is something that the Oregon Food Bank is interested in really promoting and using this model in other rural schools across the state who don't have any school lunch program because of their size. So for several years, Paisley didn't have any school lunch program because it was too hard for them to meet USDA requirements like having multiple entrees, no reheating food, things like that. And so they now operate their own independent program, which relies on donations of food and money in the community. And they also have they have one paid cook who gets a stipend, and then the rest is all volunteer labor. And it's been really successful within the community and has a lot of support. And they're getting some local beef donated, and then they're getting the processing donated for free in Burns. So they've really been able to make a successful program.
In Burns?
Mm-hmm. And then we also have a new school garden program in Lakeview, which is the first one in the county And it's one of few rural school garden programs that are much more common in urban locations. And so this is also something that people outside of Lake County are interested in using as a model for rural school gardens. They received a pretty large grant to help make that program possible. And they're going to be installing a greenhouse at Union in the next few weeks.
Union is the name of the school here?
Yeah, it's an
Okay.
elementary school.
I kept going to Union
Yeah.
County. And,
Yeah,
It's on which
it's
side?
okay.
it's located, yeah, a little out of town, and it has a total of 50 students, I believe. And so because of this increased interest in kind of youth garden education, Lake Health District was selected as one of 3 new food corps sites in Oregon, which means there will be an AmeriCorps member here focusing on K-12 nutrition, cooking, and gardening education. So they will actually be arriving on September 1st, so.
Who's sponsoring?
Lake Health District.
Oh, okay.
Yeah, and her name is Rochelle Hansen. So here's the summer meals. So right now there are no summer meal programs in Lake County. There have been a few in the past. And so this is leaving like a really big gap among students who receive free meals during the school year. In the past, and I know Vicki knows about this, in the past it was offered in the Lakeview Park. The organization couldn't keep offering it. And then it was also offered in Christmas Valley, but they canceled the program due to low participation because parents were either unwilling or unable to drive students into town to get to Sagewood Grocery because the population is so dispersed there.
I have to leave because I have another meeting, but I wanted to focus on this. There was another group that was supposed to get their certification, so Head Start set back. The Early Learning Council is what committee we're talking about this, and we're going to ensure that there's an agency that is going to start doing the summer food program. That's
Have
a
you
goal
found-
that we're working on.
Right, but you haven't found that group yet, right?
No,
Okay.
so I just saying keep in
Yeah.
touch, because yeah, that is on our September agenda. So that next summer and then that continues on, because that is such a big need. There was always high numbers of kids.
And so another thing we did was a survey of rural grocery stores in the county. What we found is most people are doing the majority of their shopping out of town at large outlet stores, either for higher quality, more variety, or lower prices. A lot of these stores are then dependent on tourists coming into the area for different natural recreation opportunities. And so their summer sales are often double their winter sales. And so because of that, they have longer summer hours. And then also several of these stores have been put up for sale and hadn't sold, so people are worried about how they will retire with no one willing to take over the stores. The lack of acceptance for SNAP or WIC is kind of limiting who can shop at the stores as far as low-income access. And then these stores are serving a number of additional functions. So like there are also the town post office and gas station and bar, restaurant, like meeting place. They'll have, different events throughout the year. So they're kind of, someone described the store in Plush as the heart of the community. So they're serving a lot of really important functions besides just providing food. This is a picture of Sid's Produce in Christmas Valley. Okay, so I focused a little bit less on this because we're focusing more on food insecurity for this group. But here are some challenges for local marketing of all of the beef produced in this area. There isn't a USDA certified processing facility, so any beef would need to be sold either whole or half if it's not USDA processed. A lot of ranchers talked about a lack of premium markets, people who are willing to pay higher prices. They're able to get much higher prices if they go to Portland or Bend or other larger cities. There's people who are willing to pay a lot more for organic or for grass-fed. And then also a lot of ranchers just want to focus on ranching. They don't want to also be marketing and advertising and running that part of a business. And then also it's hard, unless you're really increasing your scale, it can be hard to survive when prices fluctuate if you're operating as a small producer who's doing local marketing. And then in Lake County, vegetable production tends to occur more on like a home garden level. There's no one really doing commercial level production. Because of problems with short growing season, frosts, expensive water for people who are in town. But there are a lot of really knowledgeable kind of long-term gardeners. Some of the people I talked to have been gardening in the same area for 30 years. So here were some tips that I got from people. I think one of the most important ones is looking at high altitude and short season crop varieties. Someone was buying seeds from like the Middle East and Russia and all these other places that you wouldn't really think of, but we're doing really well here in this climate. Food waste, so these are some pictures I took around town of fruit coming off trees that no one was harvesting and just kind of rotting around the ground. And so this is something there's been kind of an explosion of in the last few weeks because it's a good production year. And so if a gleaning group were to be established, it could take the form of kind of having a list of trees where people kind of just have fruit trees in their yard, but they're not really interested in harvesting the fruit, and then that fruit could be collected and distributed like at the food pantry or in other ways.
Hey, do those gleaners actually do any work on the trees? If, say that you had a peach tree in your backyard and it hasn't been tended properly, do
I
they
think that
prune
could-
and stuff too?
I think that that could definitely be a part of it. I think a lot of large-scale gleaning groups focus more on like
Gathering it up, I understand,
Yeah,
yeah, but
well-
I mean, if somebody's letting the fruit just fall off, the tree's
they're
probably
probably
not
not greening. Yeah, I think that would definitely
producing what it could.
be an ideal part of it, so that you would also get the production up and the person would get a benefit from having the people come in and collect the fruit.
We don't have a,
No. So,
And what, I didn't understand that quote.
I know, dear.
so this is, yeah, I didn't talk about the first part of this. So you have a lot of like institutions, like stores and different meal programs giving all their food scraps to people for like their chickens or their pigs.
Oh,
So this person's saying like, you can have like all the spoiled milk that can't be sold anymore, like for your pig.
okay.
Maybe I should clarify that one a little more. This is about kind of demand for local foods. The Lakeview Saturday Market is working really hard to attract more produce vendors right now. What they really want is for people, even if they're not doing large scale production, to just bring in their excess garden produce whenever they have that available. And then there's also a project starting in Modoc County called the Surprise Valley Food Hub, which is right now an aggregate of 7 Modoc County producers, and they want to get more who are going to be combining their products for sale at different institutions. They would be interested in selling some of those products in Lakeview. They're focusing on a 100-mile radius around Surprise Valley, so Lakeview would be included in that. I also talked to some people at the weekend market in Christmas Valley. Right now they don't really have any food at the market, but they would really like produce vendors to come in. We also have the Lakeview Neighborhood Market, which is a second grocery store that's in the works for East Street. If it comes to fruition, they're really interested in having a local corner that features local products. And you can see some of the biggest reasons that people don't buy local products is just because they're not very available or people don't know where to find them. This is a little profile I did. They have a really substantial garden program out of prison. There's both kind of a program where you work in the garden, and then there's a 8-week course where you can earn a sustainable agriculture certificate, which can help you as you leave prison. It's kind of limited as far as who can participate in the garden program because you need to have permission to get out of the prison fence, which not everyone has. But they have really high participation. They have a waiting list to get into these programs.
But they eat it all, according to that last bullet, right?
Mhm,
I mean,
yeah,
it's not enough to feed them, but anything they grow stays there.
In the past, they donated some when their production has been up. It's been down recently because they've had pest problems. So they're not donating any right now, but yeah, it goes into the meal programs. They had a really big problem with various pests eating all of their tomato plants. So before I got here, so 2 springs ago now, there was a feast event held in Lakeview, which is a kind of visioning event that the Oregon Food Bank puts on. And it's to kind of get people to kind of organize around what kind of changes they'd like to see in their food system. And so there were 3 main themes that emerged from that. And that was that people wanted to see more gardens and local production. People wanted more food education for youth. And people wanted more of a year-round local food supply. And then this year I held a community conversation in Paisley, which is a smaller version of that kind of event. It's better for kind of small groups. So some of the challenges that people found were kind of the same things we find throughout the county: higher cost of food, lack of availability, seasonal income, set incomes among older people. But all of the strengths they talked about was how kind of close-knit of a community they are, where everyone kind of will lend each other food, everyone shares garden produce recipes, as well as their really strong homesteading tradition, where a lot of people, everyone who attended this event produced some portion of their own food. And so these were some solutions that they thought of. Establish a summer lunch program, establish a program that allowed food preservation equipment to be checked out from the library, which I thought was interesting. It was a lot about kind of like preserving and bringing back food production skills. And I like this quote on good years, you lock your car to keep from getting zucchini put in it, because it kind of shows that like the only reason you would lock your car in Paisley is to keep people from being generous.
Now they decided to put them on back porches, so you come home and you get zucchini. And our cribbage club, the last time we had a bumper crop of zucchini, we had potluck. We had 5 different zucchini casseroles. You should have been.
It's my
They were
favorite
all
dish.
good.
So these were some of the recommendations that I am suggesting. I wanted to get some people's feedback either on these or on other recommendations that they think would work well in Lake County. So the first one was to establish a gleaning group to deal with some of that excess produce. Another was to create a gardening guide based more on local gardening knowledge, because a lot of gardening information isn't tailored towards kind of high desert production. Another was to work with the Food Hub project in Modoc County, and they also have a high tunnel group where they are doing kind of once a month informational tours of different people's high tunnels and greenhouses to share information about using them in the area. Fourth was to create a summer meal program and expand weekend food programs to some of those schools that operate on a 4-day week. Coordinate between tourism promotion and local grocery stores, because we have kind of growing tourism potential in the county, like such as with the scenic bikeway. And so to kind of make sure that people who are coming into the area are shopping at some of these local stores. Another one would be a presentation at the senior center about SNAP usage, as well as how to order bountiful baskets, because you have to complete that order online. And so some people are confused about how to do that. Another is you can purchase seeds and plant starts with SNAP benefits, but there's nowhere that is registered to do that in Lake County currently. And then last I have increased SNAP education for store owners about, starting to offer SNAP if they're not. And also kind of some training for employees. There was one person told me about someone announcing that there was a problem with someone's SNAP over a store-wide intercom, so someone's probably not going to want to come in and use that again after that happens to them. So those were some of the recommendations I had thought of, so I wanted to hear what
I
people
think
thought.
you should lobby the town halls. You can have chickens in your backyard in town. You can't.
Yeah,
There could be like a limited number.
Yeah.
I really want to do this.
Trey just wants chickens.
I bought chickens and I found out I couldn't have them, so I had to give them away.
I
In a
heard you
coop?
can have
Yeah.
hens, but you can't
Yeah,
have
that's a
roosters.
falsehood.
Yeah,
I heard
you're
that
not
too.
in city limits. I checked with the city on it. You can't
Yeah.
have bees or chickens.
Bees or chickens?
Yeah.
I
Yeah.
understand bees, but what of their pets?
They said any type of farm animal. I tried. I had 2 chickens. I only wanted 2 hens.
Mhm.
Bought this coop and had it already and found out I
Oh.
couldn't have them. So I had to give my chickens away. But I think it would be.
That's changeable, it's gotta
I
be,
think
I mean,
it's
there's
gotta
so
be
many
changeable.
urban chicken coops
Yeah.
now.
Well, there's people that do it in town, they just don't.
Right.
You don't go to the
Yeah.
town council. Maybe.
Yeah, I went there.
Roosters
But
don't
they
get caught, because roosters are noisy.
Yeah, roosters are noisy, but
They are
I would think if
wonderful.
there was like a limited amount of chickens, maybe 3 chickens.
Yeah,
Yeah.
where I lived before, it was 6 hens, no roosters, and they had to be so far from your neighbor's property
Yeah.
line.
Huh.
But anyway, I think.
We just talked to all our neighbors and got them on board.
All it takes is one nasty neighbor.
Yeah.
Yeah, no, that's a really good suggestion.
But yeah, I think a lot of people could manage that.
Yeah.
And they'd have eggs.
Yeah, and right now, so, yeah, I looked into this with the city, because Christmas Valley is considered rural, so you can do it in all of Christmas Valley area, North Lake, and all the surrounding areas of Lakeview and
We
Lakeview.
could do it past a certain street in Lakeview.
Yeah.
Yeah,
Ninth is a ninth, yeah.
probably.
I know, I have.
So basically, if you have if you have 5 digits in your address, so like I'm 39 North J, I'm in town. If you go 3 streets down and that address is 5 digits, 11125 or whatever, you know, that is county, not town. That's something I learned
I'm in
working
town.
at the examiner, that we had to look at boundaries. And that's what I finally figured out is 5 digits, your county, less than that, your town. So, that's how you know if somebody's in town or county.
Well, they changed, like my house used to be 659 or something like that, Roberta, and they changed that, and I'm 18788.
You can have chickens.
I know I did. I have my donkeys too.
Go out to Cece's house and visit.
And pigs of non-commercial numbers.
Yeah, pigs. I've done the pig thing, no. Nor goats.
So-
Well, I can say, I'd like to see, I mean, and if we can get it encouraged to again, you know, with the senior center, maybe showing them or getting somebody available to help them with bountiful baskets, because I'm working as we get that back online, because right now Bountiful Baskets is working on local vendors, so we're on hold right now.
Yeah.
Our numbers exploded, and then they declined, and all sites tend to decline through the summer anyway. Actually, they shut Yuma down this summer because there just wasn't enough use through the summer, and they'll pick back up. I mean, the hope is we'll pick up again in the fall, but seeing the numbers drop so much, if we don't get enough participation every other week, we're gonna lose completely the bountiful baskets here, and it's, especially in the wintertime, it's nice to have because it's so fresh and
I
easy.
was
So,
interested and didn't know how to go about.
Yeah, I think that's why a presentation would be good, and Candace did say she would be willing to do that at some point, I know she's, you know, about to have a baby.
Oh, no, not about.
Oh, she did?
He checked in from the
Okay.
hospital a week ago,
Okay.
and that baby came early. He
Yeah.
came early.
So, yeah, when she has one more time, she did say she'd be willing to do a presentation at the senior center on how to walk people through how to order online.
I think that would be wonderful.
That would be
a good idea, for people, the advertisement or something.
Yeah, I mean, I've been learning as a volunteer, because I'm kind of gonna help back her up more as time goes on. I'll be more than happy to help with that too. Because I don't wanna lose it.
What,
It's all about me, right there.
Yeah, there you go.
what is the reluctance on the small grocers to accepting the SNAP benefits?
One told me he was worried he would offend his customers who are against government programs. And so he was worried that while he might gain some customers, he would lose some existing ones. Another,
You gotta shop somewhere.
yeah. Another, now WIC is the e-WIC card, but when it was still the paper vouchers, he had just had a hard time with the vouchers and had kind of gotten frustrated with it.
Right, because I mean, if people are using a debit card, they should be able to use SNAP benefits,
Yeah.
right? And then I can
Well,
see
you
that
have
some
to
of the stores may not
register.
have. Do all the stores have the ability to take debit?
Yeah.
Okay, so,
And then I talked to Sid's Produce in Christmas Valley, they do SNAP, but they can't do WIC because they just carry produce, they don't carry like milk and other
okay,
goods that you have to have in order to accept
to be
WIC.
part of that.
Does Safeway handle SNAP? I know nothing about SNAP.
Yeah, Safeway does SNAP and WIC.
What do you have to do to qualify for SNAP? Like Like I said, I know nothing.
So it's based, in Oregon, it's if you're at 185% of the federal poverty level, so it's based on your income and you.
Same thing like heating assistance and all those, same,
Yeah, and it
same
goes
numbers,
through the
yeah.
Department of Human Services. You can either do it in person or you can do a phone interview.
And what do you get on SNAP?
It depends on what your income is, what your allotment is, but it's basically any food product besides hot prepared foods. And then you can also buy seeds and plant starts that are food producing.
So basically like food stamps where you can't get any prepared foods.
That's
Yeah,
exactly what it is.
Yeah.
Food stamps.
It's- yeah,
It's
it's
just called
just-
supplemental nutrition program.
Yeah, it's what food stamps are
Thank
turned
you.
into. Yeah.
I think the gleaning thing's good. I have a lot of food that falls in my yard, so I'm not climbing up there to pull it.
Well, I just was walking around, especially like the north side of town, right by 4th Street, and I just saw, some of them were on empty lots and some of them were in people's yards. I saw apricots, pears, apples, everything
I
all
have
over the
apricots.
ground.
Yeah,
Plums.
yeah.
So I'm going there and I'm gonna be looking in the trees, send my kid up there then.
You don't even need to go in the trees like that. Right there.
Like,
I'm impressed, Emmy. Very nice job.
Yeah, very
Emmy.
good.
Yeah, this is really good.
Yeah, now you're gonna leave us.
I know.
Yeah,
That
I just
is
told you
sad.
what the problems are and I'm gonna leave
Yeah,
you.
yeah, that's up to you.
That's your replacement, help work on fixing it, right?
Do you know anything about local growers, like providing their, fruits and vegetables to local stores? Like, is that, do you know what the barriers are? Or
I
or
think-
are there programs that are happening around that?
I think there's just not the volume that, if something's a store, they need kind of a consistent volume. And I don't think that really exists. I think that with the new Lakeview neighborhood market, with just having kind of a local corner where they feature some products, that it doesn't need to be a regular supply, I think that could work. But like with the Lakeview Saturday market, people don't even have enough to bring in every week necessarily, so people just kind of bring stuff in.
What about the restaurants? Is it the same issue?
I think it's just not the scale. I think with the Surprise Valley Food Hub, that could happen because they're aggregating several different producers and they also have a little bit more production happening there of fresh produce. I went down to Surprise Valley yesterday and I toured a bunch of farms where they're growing quite a bit of stuff. More so than I've seen in Lake County so far.
Because I want to say that, like Oregon passed a law for rural communities, maybe like last year, and it kind of takes down some of those barriers. Like in the past, it was, I don't know if it was like food handlers permit or some sort of permitting that they were required to do to be able to sell to local merchants, and so that was removed so that to kind of support, economic development in rural communities. And I just don't know, is there
I
any,
think it's
is
just
there
the
any
supply.
prospects around, that?
I don't think I think it's the supply that's the barrier.
I was president manager of Saturday Market year before last for 5 years, 6 years. It went down to nothing and worked it up. But I had vendors from Yuba City that came up with their fruits and vegetables. From Surprise Valley came.
No one local.
It was supposedly local, and then we reached out because, and it didn't bother our market because while California's market was late spring, summer, by the time their vegetables quit, ours was ready for production and sales. And that's why we were able to keep it going from spring to September, October. And then the last 2 years, I haven't been active in it, so I don't know what their problem is now. But I always had fruits and vegetables and basically locally.
Yeah, I think another one of those laws you might have been thinking of was the home baking bill,
Yes.
which now you can't sell it in stores, but you can sell direct, and at farmers markets, you can sell low-risk baked goods without having to have a certified kitchen. So you just need a food handler's certificate.
Okay.
And everything had to be individually wrapped before we couldn't even have that.
Yeah, so before, if you wanted to sell baked goods, even just from your home or from at a farmer's market, you would need to pay to have a certified kitchen, which is
Okay, so maybe that's one.
not feasible, but that was actually the Oregon Food Bank lobbied and wrote the language for that legislation.
And now you can have it.
So now you can do bread and
You
different.
can't do like cream pies because of the eggs in the milk. Anything that spoils, needs refrigeration, you cannot bring or could not bring. Can now. But otherwise, yeah, the Catholic Church was selling salsa and all sorts of things, and a lot of people brought them in. Edna from Plush, she baked breads, and she had details of what the ingredients were individually, and she had a certified kitchen. But
So yeah, now she wouldn't have to have a certified kitchen.
exactly, but everything has to be labeled because of all the allergies that people have, so they know what they're eating. And any eggs or nuts or that are, might be in anything has, and now it's gluten has to be labeled.
Right, do anyone have any questions?
Very good.
Yep, very good.
So someone's coming in to take your place after you leave, or?
Yes, but it will be a little bit of a different format because it'll be the food corps member. So they will be more focused on youth education versus general community.
So, are some of the recommendations on here, will they be involved in trying to, make those happen then?
I'm trying to find ways where they can, and then also, I think if they have the interest, it can go into professional development. It's kind of outside of the school scope, and so I'm hoping that they'll kind of want to take those on.
Great job.
Okay.
So our next meeting is September 8th, which seems early, but it is the second Thursday, so look for something from Jen or from our vendor.
And it will be from our vendor, because I said so. And Charlie apologized, he had a phone call that he had to deal with at 4, so that's why he
Yes.
ran out of here.
Bring it.